Podcast Episode 9. I'm Aaron, your host, and today we talk with Dr. Ragu on HPV. So, hello Dr. Ragu. Good
Hello.
evening.
Hi, Aaron. Thank you very much for having me. It's a pleasure. So,
Dr. Ragu, can you tell us more on what is HPV?
so the human papilloma virus is a virus within the DNA family, quite widely existing, and it generally affects the mucosal membrane or the skin layer. So we call it the epithelial layer, and there are various types, and some of which can cause cancer, some of which are quite harmless.
I see. Okay. So, Doctor, what are the chances I'll get an HPV?
Well, everybody can get HPV. We do understand and hypothesize that it's all sexually transmitted, but that's not entirely true, nor is it confined to just that. It can be just through direct contact, person to person, skin to skin, even within public toilets and all that. So that's mainly the way. We would still say sexually transmitted though. So we see the effects on HPV infections mainly on women and mainly within the genital tract. So it is sort of focused on, and the person who I say is most likely at risk is a sexually active young lady. They would probably be the most prone to get an infection. But it can also affect men. It can affect children as well, and present in various ways, some more serious than others, some cases leading to cancers.
Okay. Effect in children, as in skin to skin.
Yes, to a certain extent, especially when children have immune issues. If they're on childhood, cancers and leading to childhood chemotherapy and autoimmune disorders, where the immune system takes a beating, they are more prone to perhaps the HPV virus subtypes which are not really that virulent in the first place. So there are more minor complications associated with it.
Okay. Okay, Doctor. So, how does HPV spread?
Well, it's direct skin to skin usually, and predominantly we used to say that they were sexually transmitted, but it's not isolated to just that. But skin to skin would be the first and most common way of spread.
Doctor, how can I reduce my risk of a certain HPV-related cancers?
Okay, so it's not to say that we can reduce the risk of a HPV-related cancer. I think the main thing is to understand that we can take precautions to reduce the transmission of HPV. So basically, a good lifestyle is important. Understanding your immune system and making sure that you take every step to improve them, because that immunity itself will get rid of any HPV infections, whether you can see it or whether you can feel it or whether there are symptoms or not. Otherwise, because we are saying sexual transmission, direct skin-to-skin contact is something that we'd like to avoid. So barrier method contraceptives like condoms play a very important role. Good hygiene, certainly. And also understanding that just because you have an HPV infection, it doesn't mean that you're going to develop cancer. A follow-up or a cervical screening program should be in place, considering that HPV is mostly related to cervical cancers.
Mm-hmm. So, Doctor, just a question. Can this cancer be for men and for women and for children?
Indeed, they can. But there are various subtypes, as we explained, in excess of 150 types. We do know there are high-risk and low-risk types. Mainly, we understand that 16, 18, 31, 33, 45, 52, 58, they tend to cause majority of the cancers. They can cause cervical cancers in women, along with vulval cancers, vaginal cancers, any cancers that have more of a mucinous epithelium associated with them. Having said that, the mouth has a mucinous epithelium associated as well. So oral cancers, anal cancers, anorectal cancers, we now know that even nasopharyngeal cancers are sometimes caused by the virus itself. So it does not just, it's not confined to just cervical cancers. There are various cancers affecting either men or women which can be associated with HPV at this point in time.
Okay, all right. Thank you, Doctor. So moving on. What about the safety of the vaccine? Is there a vaccine?
Okay, so certainly every vaccine, any foreign object that's put into us brings along with it some fears. And when you're looking at vaccines, it's a long-term assessment as to its safety and efficacy. And certainly with HPV vaccine, it's not something that's just come up. The first vaccine was released in 2005, but there was work done on it from the 80s. Having known the cause of cancers, having known that they can develop some vaccines against it, there's been a lot of work done behind the scenes. And importantly, after the release of the vaccines for public use, there was a particular trial called the Patricia trial, a phase 3 trial which shows an safety efficacy, which shows very little or no increase in any adverse outcome compared to general public. Which means if you take a certain number of the general public and you not vaccinate them, and take the same number of the public and do vaccinate them, the actual occurrence of an adverse problem is exactly the same in both groups. So because of that, the Global Advisory Committee based in Switzerland, they have themselves said that this is an entirely safe vaccine. You are always going to be wary of an individual response, adverse response to a vaccine. I think to any medication, to any vaccine, you're always going to be a little bit aware of it. So I think the basic signs and symptoms of any complications should be informed to the person receiving the vaccine. But no, I think nothing more than, very, very safe in with all the studies that were done.
Okay. Right. So, Doctor, is HPV, there's any medication for HPV?
There is no treatment for HPV. There is prevention for HPV. There is treatment for the complication associated with HPV. But there's no therapeutic treatment available for this particular virus infection. However, a person who has had the vaccine, even if they have had the infection prior to receiving the vaccine, they've actually shown a higher degree of immunity against the virus. So let's say you had the viral infection for whatever reason, and then you had your vaccination done. They find actually a higher incidence of resolution. That means improvement after that.
Okay.
So, but again, the vaccine was never designed as a therapeutic vaccine, but a preventive vaccine.
Okay.
So but there's no treatment though.
There's no treatment. So I can walk into any hospital and get the vaccine for myself? Or
Well, a woman can walk into any hospital and get a vaccine for herself.
Okay, alright.
If a man walks in, we do not have enough evidence to suggest that an adult man will actually benefit the public by having a vaccination.
Okay.
The risk of any effect on a man, fortunately I would say, is far less reaching than for a woman.
Okay.
Yeah, so I think Australia was the first country that did a global vaccination for even young boys, starting at the age of 9, and they have created what's called herd immunity. Yeah, so rather than the girls just protecting themselves, the boys are protecting the girls by being vaccinated as well. But there's no evidence, no study looking at adult men changing that outcome at all. Vaccinating an adult man makes any changes. So yes, for a woman, by all means, certainly you can walk in, and certainly you're going to have added immunity against the effects of a papillomavirus infection.
So just Doctor, one last question. If one get infected, how long will it be there for a long time?
Okay.
Or
It may remain there for an indefinite amount of time. However, 50 to 80% of people would have it, would get rid of it within 2 years.
2 years.
Yeah.
But that's not like a confirmed.
No, there's no confirmed son. But then again, without any symptoms, nobody would actually be testing for it.
Correct.
Yeah. So the only area where it has been used as a screening tool, the presence of HPV, is in cervical cancers, where rather than just do cytology, they've used the existence of certain virus types to ascertain whether the patient has a higher risk of developing cancers. And beyond that, they've actually started checking the protein levels in the patient's cells, a particular protein, the protein E, which further increases the risk of the cells, the actual cells responding to the persistent viral infection. So, you're going from one step to another step to molecular biology and all that. But yeah, I mean, generally the understanding is most people will get rid of it within 2 years.
Thank you so much, Doctor.
No
Thank you
problems,
for
my
your
pleasure.
story. Is there anything you'd like to say to our viewers?
Okay, yes, I would. When I first started doing oncology and was in the government service, we used to do cervical cancer surgeries very often. I think we do every 3-4 months, 3 to 4 a month. And we'll be getting cases that are coming in from stage 3, 4, where surgery is no longer an option and radiotherapy was the main treatment modality. After 2005, what we found is a very pronounced reduction in the number of patients requiring these surgeries, a reduction in the number of patients requiring radiotherapy. So the vaccine works. We've seen it work. So it's a choice to protect yourself. And I think knowing that there's an option there for you, I think that's important.
Thank you so much, Doctor.
No problem, my pleasure.
So, thank you so much to every one of you. So, till we meet the next episode, peace out.